Prevention Point started when I started working for the Haight-Ashbury Drug Detox Clinic. I was hired to draw blood and run their lab. And at the same time I started, which was 1982, was just the very beginning of when we were starting to realize there was something going on. And even though we didn't know very much at the time, we did know right from the beginning that it was spreading the same way as hepatitis B. And that told us that our needle users would be at risk. In the spring of '88, Dave Purchase started a street-based needle exchange in Tacoma, Washington. And we were very much in favor. So we got all excited. One time there was a, thank God it's Friday, after work session at El Rio, which was the local bar. And somebody starts talking about Dave Purchase's street-based exchange. And everybody says, let's do it. We can do this. If Dave can do it, we can do it. At the time, it was illegal for anyone in the state of California to have a syringe in their possession unless they had a prescription for it. In September, I remember we did sort of like market research, which meant we rented a room in the Ambassador Hotel, which was the sleazy hotel south of the market, and had a lot of addicts who lived there. And we invited every addict we knew for food. We used what they said to influence our decisions about what we were going to do. And we decided to start on November 2nd because it was close to the Day of the Dead. The thinking was all the ghosts of the people who'd passed would be there to protect us, keep us on track. It was quite a disparate group, actually. They were all smart. They were all feisty. It's like herding cats to get everybody on the same page. We had AIDS activists. We had ex-users who'd been in recovery for a long time. We had people who were, civil rights activists, anti-war activists. We had a bunch of anarchists. We had a bunch of witches. It was all people who were kind of used to not going along with the mainstream. I was kind of an unlikely choice. I was, middle-class white mother of teenagers trying to earn a living. And in the beginning, when people first started before '88, like in the earlier '80s, people would sometimes talk about needle exchange, and I'd say, let Mayor Silberman do it. He's the one pulling down the six-figure income to protect the health of San Francisco. So it's not my job. That's what I used to say. But the problem is, as I got sucked more and more into it, and people were dying all around me, and I was well aware of all the data, I couldn't keep that attitude. And I felt like there was this big disaster happening, and just more by chance than design, I was in a position where I could put my finger in the dike and stop it for a while, at least, until we could get the mainstream politicians to step up and do what they should have been doing all along, but weren't about to. We had two teams, the stationary team and the roving team. And the idea was that the stationary team would stay on the same corner and do needle exchange every Wednesday night in front of God and everybody, waiting to get arrested, because we assumed we would get arrested as soon as people figured out what was going on, and then we would hold a big trial, and then we could bring all this data in. And then the public health department would surely step in and say, no, we'll do this so these radical people won't run off the rails with it. So we put all the people who had lots of experience getting arrested for anti-nuke and civil rights actions on the stationary team. And then we put all the people who were mostly focused on getting the needles out, not that crazy about getting arrested, like me, on the roving team. And the first night, we did a sum total of 13 needles, 7 on the roving team and 6 on the stationary team. So it was very small to begin with. This is how we rolled. We had a very ancient, and I mean like 1930s and 40s ancient, metal baby buggy. And I had an old sleeping bag that used to belong to my daughter when she was younger, a Alice in Wonderland sleeping bag. And we put the bio bucket and the needles and the cotton balls and the alcohol pads, all the supplies. And then we covered it up with the Alice in Wonderland baby blanket. And then we would drive to the first place we stopped, which was the Civic Center Park, the park right outside of City Hall, which at that time in 1988 had a very large homeless encampment. So that's why we stopped there. And addicts would count their needles into the bucket, and then we would give them the same number back of clean ones. That was the idea. Then we'd pack it all up and we'd walk down Market Street, pushing this baby buggy. We all dressed kind of like street people, so we'd blend in. And we'd be walking down, and people would sidle up to us and say, "Can I feed the baby?" And we'd say, "Oh, yes, the baby's always hungry." Before the needle exchange, people would run around with these old dirty needles that they'd been using 3 times a day for a month, and they'd have lost the cap because the caps get loose after a while and they fall off. So there'd be this dirty point sticking up, and they'd have it secured somewhere on their person, and then the cops would arrest them and they'd have to pat them down looking for weapons, and there was a risk of getting stuck with the dirty needle, which no cop was very enthusiastic about for some strange reason. So they were happy when we started doing needle exchange in their territory, because all of a sudden all the addicts would have new clean needles with caps on them. So most cops actually were happy with what we were doing, but not all. Then, of course, once the story was out, we started getting all these phone calls from media because they wanted to come and film the exchange. And we always thought Channel 5 called the cops. We have no proof of that. We just thought that. But what did happen was the media all showed up, the cops showed up because they'd been called, and arrested the Prevention Point people, which arrest was all on the TV news that night. So that was our big outing. The thing is, we thought at that point, okay, now we're going to get our big trial, right? That we'd been prepared for since way back last November. But the DA at the time in San Francisco was not the least bit interested in wasting public money on trying a bunch of AIDS activists who were trying to stop the epidemic. So he just dismissed the charges. And that went on for years. Meanwhile, we were having meetings with Art Agnos, who was the mayor at the time, Merv Silverman, who was the head of the public health department at the time, and Frank Jordan, who was the chief of police at the time, in secret. And we were explaining to them exactly what we were doing, what our thinking was, why, what the numbers were. And, in New York, there were neighborhoods where 90% of the addicts were positive by that time, and most neighborhoods were 50% in New York. So we felt like we had this narrow window of opportunity to stop that from happening in San Francisco because our numbers were lower to start with. Of course, when we started, it took us from September to May to do our first 1,000 needles. Now, those we could kind of scramble and get. But after a few years in, we were doing millions of needles every year. We were the largest needle exchange in North America. And you can't apply for grants to all the various granting organizations to do something illegal. And we had no visible means of support. So it was getting pretty tough. Fortunately for us, Frank Jordan, remember, he had been the chief of police. Well, at this point, he was running for mayor. First time I ever voted for a Republican running for mayor, because as part of his campaign, he promised to legalize the needle exchange one way or another. So he did that. When once again the Republican governor vetoed it, he used the emergency powers to fund the needle exchange. And what that basically was the same people, same volunteers on the street, but with paid administrative staff that was paid by the AIDS Foundation through this grant. And also, of course, they provided all the needles and the equipment. I think we did a really smart, good job at a time when the virus was spreading quickly and the politicians and powers that be weren't ready to move fast enough. You know, eventually they got ready to move, but not fast enough. And we managed to prevent a large secondary spread among the needle-using population in San Francisco. We never got the hundreds of babies born HIV positive in San Francisco, only a little handful. It made a big difference, saved a lot of lives, and I'm proud of that.